Headache is one of the commonest neurological conditions that we see in clinical practice. Headaches are categorized as primary headaches or those which don't have any specific structural cause in the brain, and secondary headaches where there is a definite structural cause in the brain. By and large, a majority of headaches are due to primary causes, and this includes headaches like migraine and tension type headaches and cluster headaches, trigeminal autonomic cephalalgia, and secondary headaches are due to local causes in the head and neck region like a sinusitis, or more sinister causes in the brain like aneurysms or tumors or brain infections, etc. So it's important to recognize the cause of headache so that one needs to decide whether a scan is required or not. So headaches which come with some warning signs, for example, if there is early morning headache, persistent vomiting with the headaches, presence of any deficits like weakness on any one side, double vision, and a headache which is continuously present, or a headache which is very severe in intensity occurring for the first time in somebody's life. So these are indications of a sinister cause in the brain, and it will require an MR evaluation or a CT scan to see what is causing the headache. Most of the headaches don't require a scan, and a good clinical history and a description of headache helps to make a diagnosis. The treatment of majority of primary headaches is categorized into two: the non-pharmacological therapies and the pharmacological therapies. The medicines that we use for headaches are again categorized into two. One is that which helps to abort an attack or which gives an immediate relief from the headache, and there are various categories of medications which might help here, and it's chosen based on the patient's response to previous medications and the severity of the headaches, and also taking into consideration various other comorbidities. But these acute medicines should be taken only when the headache is happening, and the prophylactic medicines are quite important, because if the headache is quite frequent, one can prevent this by appropriate medications. So again, there are various types of medicines like topiramate, beta blockers, calcium channel blockers, antidepressants. So the medicines are chosen based on each individual's characteristics. But none of these medications actually cure the headache. They help to reduce the severity and frequency, and often on discontinuing the medications, the headaches do come back. So there might be years where the headaches are very frequent, and during which we need to use these prophylactic therapies, and years when the headache frequency is relatively less, where we can use an SOS analgesic medication. But to prevent many of the headaches, it's very important to look into the non-pharmacological therapies or the alternative therapies. So many of the headaches, typically the migraine headaches, can get triggered by certain factors. For example, not sleeping well, too much of stress, sunlight, not having food on time, dehydration, etc. So if you have a definite trigger factor, then it's important that you avoid that. For example, perfumes, certain types of foods, or certain environments, intensely watching movies, etc. In general, proper sleep, about 8 hours in a middle-aged person, plenty of fluids, at least 2 to 3 liters of fluids, having food on time, avoiding sunlight, keeping the hair dry after a hair wash, and breathing exercises are necessary to prevent many of the headaches. We have with us Dr. Shashikant and Dr. Gopinath, who are experts in treating headaches with many of these non-pharmacological therapies. Dr. Shashikant will discuss about various therapeutic measures available for headaches from alternative systems. And Dr. Gopinath will take us through the Ayurvedic treatment available for headaches.
Namaste everybody. Here is Dr. Gopinath K. Upadhyaya, working as a Ayurveda and Yoga consultant at Poorna Holistic Healthcare. I'm here giving brief introduction about the role of Ayurveda in the treatment of headache. According to Ayurveda, headaches are commonly associated with an imbalance in the doshas, which are fundamental energies that govern our body and mind. The three doshas in Ayurveda are Vata, Pitta, and Kapha. Each dosha is responsible for different physiological functions, and an imbalance in any of them can contribute to the occurrence of headache. From an Ayurvedic perspective, here are some possible causes of headaches. First one is Vata imbalance. If the headache is accompanied by the symptoms such as anxiety, restlessness, and sensitivity to light and noise, it may be due to Vata imbalance. Factors such as excessive mental and physical stress, irregular daily routine, and inadequate rest can aggravate Vata. Second category is Pitta imbalance. Headaches associated with symptoms like intense heat, irritability, and sensitivity to bright light may indicate the Pitta imbalance. Pitta imbalances can be caused by factors such as excessive heat, strong emotions, overexertion, and consumption of Pitta aggravating foods. Kapha imbalance is next category, where headaches accompanied by a feeling of heaviness, congestions, and dullness may be associated with kapha imbalance. Kapha imbalances can be triggered by factors such as poor digestion, excessive sleep, lack of physical activity, and consumption of heavy food, cold food, sweet food. It's important to note that these suggestions are general in nature, and it's always recommended to consult with the qualified Ayurvedic practitioner for a personalized assessment and guidance based on your specific conditions and constitution. Combined doshas like Vata, Pitta, Vata, Kapha, Pitta, Kapha, or even sometimes all the three doshas combined also manifest as headache. Treatment options. Ayurveda takes a holistic approach to headaches, addressing the underlying imbalances in the body and mind through lifestyle modifications, dietary adjustments, stress management, and herbal support. Consulting with an experienced Ayurvedic practitioner will provide you with a personalized guidance and recommendation tailored to your unique needs. The treatment options in the headache aim to address the underlying imbalances in the body and provide relief from symptoms. The specific treatment approach may vary depending on the individual's constitution, the dosha imbalance involved, and root cause of the headache. Here are some common treatment options used in Ayurveda for managing headache. Majorly in Ayurveda, headache is treated in two categories. First is some of the therapies, which is commonly called as panchakarmas, and next is the medicinal treatment. In therapies, the major role of Nasya program, where Nasya refers to the administration of medicated oil herbal preparations through nasal passages. It is believed to be effective in alleviating headaches caused by imbalances in the head region. Also, another option in the therapies is a Shirodhara, which involves pouring of continuous stream of warm medicated liquid on the forehead for certain time. And next major treatment involves some of the herbal remedies. Ayurveda utilizes wide range of herbs and herbal formulations to manage headache. Commonly used herbs are Dashamula, Haritaki, Brahmi, Shankapushpi, Jatamamsi. Herbal remedies can be taken in the form of powders, tablets, decoctions, or oils. It is advisable to consult with Ayurvedic practitioner to determine the most appropriate herbs and formulations.
Welcome friends. We discuss about integrative modalities of treatment for headache. We insist you to get the types of headache evaluated from your concerned physician or neurologist, and then try our evidence-based integrative modalities of treatment. So based on various available integrative modalities of treatment, we have chosen few. They are acupuncture, biofeedback therapies, manipulation therapies, massage therapies, mind-body therapies like biofeedback, mindfulness training, mindfulness breathing techniques, and mind imagery techniques. This will help you mainly for the people with headache which are mainly caused by stressors or tension. Tension type of headache, cluster headaches, and few other headaches will be more beneficial with these therapies. What we designed, all these therapies are based on our vast experience in this field of integrative medicine, integrative neurology for more than a decade, and we assure the best of evidence-based therapies for you. So when we discuss about acupuncture, acupuncture is a principle based on the traditional Chinese medicine system where they believe that there is a flow of energy or qi in our system, and if you manipulate that particular qi with either acupressure, acupuncture, or moxie or electrical needle stimulation, it can modulate the pain sensations and reduce the intensity of headache. Maybe it will work by producing enough endorphins, like few of the research says that, and some of them changes the pain perception. Some deeper pain, you perceive a superficial pain where there is a stimulation of nociceptive stimulus or C fibers, subcutaneous C fibers, and you forget, the brain forgets the deeper pain. So various mechanisms, some of them proven, some of them yet to. So we use as evidence-based practices as possible in acupuncture. So next one is breathing technique. If the headache is related to mainly tension type of headache, migraine headache, or other forms of somatic headaches, you get maximum benefit if you work on the regular pattern of breathing. Say for example, when you are stressed, anxious, or angry, your breathing will become short, irregular, and erratic. So there is a sympathetic dominance in that. So sympathetic dominance increases the breathing frequency and irregularity of breathing. So correction of that irregularity can help you to stimulate the parasympathetic nervous system, and by that the muscle tension can be reduced and the intensity of headache can be relieved or alleviated. So regular pattern of breathing, we use our own indigenous innovative technique of 4-4-4 breathing technique or 6-4-6 breathing technique with some of the mudras where it can help you to relieve or defocus your mind from the focus of headache to something neutral. So use something like Shankhamudra and you focus your attention on the blood circulation of that thumb and you do the regular pattern of breathing. By this we claim that your parasympathetic nervous system is stimulated, your relaxation response is set in, and the endothelial release of nitric oxide can cause the magic of relieving your headache. So when you are attending our extended relaxation technique program, you will learn all these techniques. Mind-body techniques like mindfulness breathing, mindfulness meditation, or mind imagery technique can be mainly useful for headaches which are like cluster headaches or migraine headaches, tension type of headaches, where the focus of mind can be dissociated or distracted to something else, something neutral, either your breathing or something mind imaginations, where we make the person get their mind dwelled into a system of a series of imagery techniques which are particularly helping you to dissociate your mind and induce a deeper sense of relaxation. By that, the muscle tension can be reduced and headache can be relieved. Some other methods like massage, manipulative therapies, or biofeedback devices are also used. So some biofeedback devices which can be put it on your arm, which can continuously emit certain frequencies where the nociceptive stimulus to the brain can induce a sense of relief from the headaches. So there are some proven techniques, and few gadgets are yet into the market which needs to be proved and approved, and we use some of the gadgets for that. Few other methods like chiropractic or acupressure therapies and some other herbal treatments, Ayurveda treatments are also being used for headache. So we discuss and adopt based on the individual case of your headache, based on the type of headache, based on the frequency of the headache, based on the intensity of your headache. We chose the combination of conventional and complementary therapies. Hope you enjoy our seminar on headache and get the best out of it, so that lifestyle modification can add in relieving your headache completely, or at least to a level that you can sustain the headache much better with minimal medications. Thank you.